right. Hi, everyone. Let me get the presentation up and going. All right. So good morning, everyone. My name is Isaac Baez. Thank you so much for the introduction. I am the Engagement and Inclusion Coordinator for the Stark County Mental Health and Addiction Recovery Board through the System of Care grant. And so thank you so much for having me again here. And I want to make sure that this is a continuation from the previous presentation. I know that you've talked about terminology and understanding a little bit about the community. And so I want to try to dive into some of the other factors that are important for the LGBTQ plus community. I also wanted to let everyone know that there are some slides that you will notice that they will mention LGBT. And so when you see that, it's only because the information or the data that was collected and placed is specifically talking about the L, G, B, and T of the community. So it doesn't include the Q, the I, the N, the A's. And so it's always a good thing when you look at your data work for the community, you understand that it's really talking about a specific part of the group, not the group as a whole. We still have a lot of work to do ahead of us, making sure that when we collect data, we're collecting information about every piece and person from the community to have a better understanding. Here is our slide. This is just what our mission and vision at Stark MAR. But I want to get into the stigma and discrimination in health to understand why this information, to understand the community is so important. And why we're doing what we're doing here. And so it's very common for people from the LGBT community to go through a lot of discrimination. And so here are just some data factors. 39% rejected by a family member or friend, 30% threatened or physically attacked, 21% threatened unfair by an employer, 30% of youth missed at least one day of school because they feel unsafe or uncomfortable. And this information can change if you think about how it could be for families that are going through COVID right now, COVID-19. There are some individuals who have said that they feel comfortable being home because they don't have to go to school or be bullied. But if being home is unsafe too, so now their unsafe factor could be the home as well. And so that can vary depending on what's going on currently. And so among the transgender people, 61% physically attacked, 55% lost a job due to bias. And I want you to think about, some of the daily chronic stigma that can lead stress, anxiety, depression, and other health disparities for the community. And so, and then when we look at like the healthcare part, some patients have reported that use of excessive precaution or refuse to touch them. And so individuals that have to go to the doctor's office, if there's a physician, or we can even talk about counselor or therapists if they're not feeling comfortable with them, just being very precautious with them or not making them feel very welcome when they're coming into their appointment, blaming them for their health status, or using harsh or abusive language, can be very harmful. For the trans community as well, being harassed in a doctor's office or being denied medical care at all. And I think that's really important to think about. If you're a person part of the community and you have to find a physician to talk about personal stuff, for any of us just to talk about personal stuff in a session, it can be really difficult sometimes, just trying to be open about whatever's going on. And so then adding the layer of being part of the community and having to have some discussions about your activities, who you are, what you do, or even your sex life or whatever it is, can be a little bit tough for the community to be able to open up to someone if they don't feel welcomed or comfortable or safe in that location. Think of telehealth right now, how hard it is for some patients that if their families don't know about them and they're doing a visit and they're getting questioned about certain things and they can't be really honest about it. It could be a therapy session too as well. I know some people in the community and that have to go into their cars or wait till after certain hours to be able to have discussions with their counselor, therapist, or physician just because they're afraid that their family members might know something is going on or they might be outed because of that session. And so they have to be very careful on how they speak. And so, you know, being a little bit open, it can be very, very tough. And so when you look at, you know, this data information, and again, this is just simple data work. We don't have everything for the whole community. I want you to think about how much that stigma and discrimination can cause the chronic and acute stress, how much it will impact not just their mental health, but physical, access to care, and even access to competent care, and which will increase health disparities and inequities. And I want to add another layer to this. There's a lot of intersectionality. Our LGBTQ plus community is very diverse. We have people from multiple parts of the world, race, ethnicities, that, you know, add a different layer. If you talk about the African American community being part of like the trans, or if you talk about someone who's Asian or Latinx who's part of the community as well, and how much of those intersectional barriers can add a multiple layers on when getting services. It's a lot to intake to have to feel every day that you're being observed in such a way, or you don't know who you can talk to, or if you say something to someone new, are they gonna treat you wrong? Are they gonna look at you wrong? Or are they gonna get, and so it's unfortunate to have that feeling every day and walking through this world where you just don't know, or you're not sure if it's okay or if it's safe to be just who you are. No matter what your sexual orientation is, no matter what your gender identity is, or no matter what your gender expression is. And I know you learned about all those points through the gender unicorn, who's my buddy back here. If you think about all those multiple layers that the unicorn has, thinking about how it must feel for that person to have to go through each day when it comes to just access to services, period. And so, you know, the health disparities, this can include HIV and sexual transmitted disease, anxiety, depression, suicide ideation and attempts, substance use, smoking, lack of peer and family support, homelessness. There are no LGBT specific disease or illness. However, LGBT people are more likely to experience certain health issues compared to people who are not LGBT. And so the LGBT health disparities on this slide have been documented through a report too as well, and that references are on the PowerPoint as well. And also, I want us to remind everyone, youth homelessness is super high. We don't have enough data here in the state of Ohio, and even from the local level where I'm at too, when we did the count for youth homelessness, we weren't able to find any youth at all. And so when you look at the data for youth homelessness, close to 50% of those who are homeless are due to being part of the community because of being rejected at their house or home. And so it is a huge increase to think about that half of that population is part of the community. So that is a huge disparity because they're already being set to go through a lot of trauma, hurt. Some of them even use use sex to be able to survive, which is called like survival sex, because they're having to stay at someone's home that might be unsafe for them, or it could be an abuser's home. It could be someone who's, using them for sexual pleasures, but just to be able to have a home and food. And I'm going to be honest here, this is stuff that I've actually talked to some community members. So these are real things that are really happening. I have close friends who have gone through stuff like this, and they were able to move forward and get out of those situations. But it is a reality that happens to them when they really didn't have a choice, to be able to survive. So I don't want this to be a presentation about how sad and everything is, because it is these real factors, but I want us to remember that there is resiliency in the community. Despite of everything that's going on, the community's still fighting, they're still standing strong, they're still trying to make sure that advocating for people's right, to making sure that everyone that is part of our community is being heard. And again, you have to remember, our community does intersect with multiple people from different areas and realms of demographics. And so services and support, I have 6 things here, but I don't want we're not going to talk about all of them. I do want to talk about at least the first 3 when we look at services and how important that support is. Mental health is huge. Thinking about some stability, when we talked about all that chronic stress and trying to find support or way to be able to accept themselves, to not have to go through every day thinking maybe I need to change, maybe I need to be different, maybe I should be straight, and trying to fight it on a day-to-day basis instead of feeling comfortable with who they are under their skin. It is a process sometimes. So coming out, it takes time. They have to think about it a lot. It could take years. There are people who are from like older generation too as well, who are still coming out of the closet just because they've had so much struggle all their life. And so when we're looking at the youth, thinking how we can prevent them going through all their life of trying to figure it out or trying to just be who they are. Sex education is really important. Sex education is still tough, and not all schools might talk about this. But imagine what sex education would look like if we're talking about the whole community. It's going to look different than what the straight world would look at for sex education. And so tough conversations again, but it is important, as you can see, that there's some risky stuff that can go on without that knowledge. And we know that if people don't have that knowledge, they won't make better decisions. And so we really do need to think about those factors. Where can they get then information about learning about it? And most important too, that is a huge struggle, is for parents. I get that some parents might not feel comfortable with the child, or they don't understand where they're coming from, but trying to make sure that parents still have love for their own child at their home and get education about how they can come to a better understanding with them, or being a little bit more lenient to that. Not saying that they have to go to Pride wearing a whole bunch of rainbow flags and getting their face, with rainbows everywhere. They don't have to do that, but being at least able to accept their child in the home is such a huge factor when it comes to this. And for anyone out there, if you are still learning about the community, you don't feel prepared to serve the community, that's okay. Just make sure that they find someone who can have those conversations with them. It is okay, like what we're doing here with the Echo, where we're talking to each other and trying to figure out what can we do better. Talk to other peers or professionals that are at your level that can help you understand a little bit more. If you're trying to get more better at serving the community, or if a client just comes up to you and finally tells you after like the 5th session, hey, I'm part of the community. And so trying to figure that out, or trying to talk to the parents, because maybe the parents don't know what to do and you're still trying to talk around, because there is a lot of information out there. And so I'm leaving the slide here. I'm not going to read through everything, but these are some good ideas in general, just for everyone at your agency or organizational level, of what you can do to be better supportive of the community. And thinking about ensuring appropriate services or facilitating access to services, saying, hey, you know what, I know another counselor, therapist, or I know a physician who's very comfortable working with you, and I want to make sure that you get some good service, and I want you to feel competent, or having people go through more training. And so trying to make sure that you learn a little bit more about every day. I myself, even though I am part of the community, so I'm outing myself, I am cisgender, gay, Latinx person, and so I don't talk for the whole community. I only can talk about in general what's going on. And so I myself have to learn every day about the community itself. I came from Dominican Republic in 2014, actually, here to Ohio. So my gay world, my LGBTQ plus world, was very different in Latin America and a Caribbean island versus to when I got here to Ohio. And I had to reintegrate myself into the community and like, what is going on here? What are all these terms? Because there were so many things that were being moved forward that were very different for me. And so I had to learn myself. And so I want you to understand that the learning process for these concepts is something that we are all going through. So you're not alone when it comes to this. What can you do now? Get more training. This is just 15 minutes that we have to be able to have this conversation, and we can't really talk about everything. If you are prepared, share your pronouns. You can add it onto your Zoom call. You can add it on your business cards. You can add it on your email. Letting that person know, hey, you are a person who understands and wants to be an ally to the community. Make your space welcoming, put a pride flag around, have things prepared that you can let the person know, hey, I am a safe person that you can talk to. You don't have to be direct with them and saying, hey, I think you're gay and I want to make sure you're comfortable. No, just let them come to you and open up. And once they give you that trust, and if you don't know what to do, thank them for being open with you, because it's a whole big step for that person to come up to you and tell you, hey, I just came out to you, and it's huge for me when I am telling you, because it's something personal and intimate. And become a trusted adult by being an ally. And so what is an ally? We're going to get to that. And so these are the 5 tips that I want to leave for you as we close of how you can be an ally. 1, understand your privilege. If you're not part of the community, or if you are part of the community and you're cis and don't understand like the community members who are trans or asexual, understand that you have sometimes privileges. There are people that, you know, can go through the world and look in a certain way and not categorize of what people would say, oh, their gender expression are so very male oriented or female oriented that no one would second guess who they are. But some of us have that privilege. We can walk through life, but others do not have that option because they express themselves so differently. So it can be very tough. Listen and do your homework. It is not possible for you to learn if you're not willing to listen. So, you know, learn that we have to research and study and learn more. And so you have to go through that process. Speak up, not over. So the role of an ally is to support. So make sure that you're giving space for that person to be able to have that conversation and talk. And if you do make a mistake in step 4, just apologize. No one's perfect, and learn from those mistakes. And also, ally is a verb. So just saying that you're an ally is just not enough. You have to do the work to be able to be a true ally. And so I left my references here. I also sent a reference of like some stuff that you can read. I don't know if, Kara, if you were able to send that out, or you can send that out probably afterwards. And so I have like a list of references that you can have to on a separate slide. But if there are any follow-up questions or anything, you're more than welcome or free to contact me as well. All right. I think I went over close to a couple of seconds.